and then tinnitus or tinnitus, depending on which doctor I speak with and which day of
Absolutely,
the week.
and they're both fine.
In weeks, again, I speak from experience. I've had that for years and years. And for me, it's like sitting inside that audiology booth. That's the noise. I mean, there's times when I'm sitting there thinking that's what I'm doing is taking the test again. Or when I'm in the test, sometimes it's like, oh, is that the real one, or am I catching something in my ears?
Oh, yes. Yeah, we hear that all the time.
And you all work with that stuff too.
We work with that stuff too. So within the VA, there's a program called Progressive Tinnitus Management, which is a couple of classes that you come to. You learn a lot about it, and then you learn strategies for coping. There are certain pieces of equipment that we can help with. The bad news about tinnitus is we can't fix it. What we do is we try and cover it up or distract you from it in some other way. Sometimes it's as simple as turning on a fan.
Mm-hmm. Yeah, a little white noise.
Little white noise. Yes. Little white noise. People say, I do much better in the summer because the air conditioner is loud.
Yep.
You know, things like that. If it gets really bad, there are devices that we can give you, either noise generators or, fancy things built into the pillow to help you sleep at night. Some people will even wear a device that looks like a hearing aid that puts a different sound in your ear. A lot of hearing aids are both at this point. They're amplifiers and they're maskers. That's the word we use to describe them. So you can flip to a different program and get yourself some relief.
Good. And it is. It's relief. And you're right, because it's if in the military, of course, your noise level is at 10.
Right.
You get out, it may be down to a 4 or a 5, and that's when whenever I talk to people, we're doing outreach, and we're talking to veterans. I always ask, do you have any of that ringing and buzzing in your ears? Like, oh, I don't. No. It's a yes or no question. No, only on Tuesday nights when I'm watching Pat Sajak and Vanna, or and it's like, stop, just give me a straight answer. And it's always, almost always, yes, I do. And it's sometimes, because of experience, I tell them, look, that's how it is usually. When the noise level's up, you may not notice it. It's still there, probably. You just don't notice it. Like I said, it's masked.
It's still there, yeah.
So,
when we're talking to them, I'll say to them, okay, do you feel like it's there all the time and you just don't notice it when it's noisy? Or does it actually start and stop? And for some people it does. They only get it once a week, and they'll say, yep, it starts, I don't know why, and it goes for a half hour, 3 hours, and then it stops. I don't know why. And
for some people it's disruptive for their sleep.
Yes.
They can't get to sleep because, and again, you're in a very quiet spot typically.
Absolutely.
And you're trying to fall asleep, and all of a sudden you've got
this noise in your ear, and it could be, and it's a funny thing when the guys come in for the compensation evals. I should say guys and gals. They come in for the compensation evals, and we ask them the questions, and we'll say, when did it start? And they'll say, well, when I was in Iraq, it was so noisy that it probably was there, but I just didn't hear it.
Right.
It was when I got home that I noticed it. And so it's absolutely true that it's usually a kind of a squishy answer. When did it start?
Well, I think people get nervous answering it because they're like, oh, am I going to disqualify myself or am I lying? What am I doing here? So I think, yes,
exactly.
It's very common. And one of the questions we get asked often is, what test is there that...
So that's an interesting question. So we don't actually test for it. We do a hearing test, and that tells us a lot about what's going on in the ear, because the ringing or buzzing or hissing or whatever sound you hear is caused by the damaged ear. So what's happening? Your ear is telling your brain there's a sound when there isn't one, because it's not working properly. You can have tinnitus without a whole lot of hearing loss. You can have it even with normal hearing if you've been in noisy environments.
Right, sure.
But it's, we can figure out why you might have it. We don't actually test for it because it's
There's no
subjective. There is no test.
Right.
I
You
can't
can't
hear
look in
it.
there and just see it.
I don't see it,
See that
and I
bell
don't
ringing?
hear it.
And that's a conversation, I have with veterans. We do outreach. We go into the community. We're talking to veterans, and we get into these conversations,
Yeah.
especially.
Yeah.
And that's what. Oftentimes, it's like, well, how do they know if I have? It's through the questions that we ask
It's
and
through the
talking that we
questions,
do
yeah.
with you. That's how
Yep.
we'll find out. And your honesty to simply tell us,
That you heard.
I hear something.
Yeah.
And I could still remember, and it was long after I'd gotten out of the Navy even, but I was doing something one day, and I started looking around the room, and my wife was just staring at me like, what is your problem? I said, you don't hear that?
We
And
hear it
she's
all
like,
the time.
what? And I'm like, it's a noise. And it was, she goes, it's you. And I'm like, oh, okay, sorry. I'm going to go up to the VA, I think, and
Right.
get checked out.
And see if I can figure out what's going on.
But it is,
Yeah.
I mean, and there's different types of noises for
There are
people.
different
right?
types of noises. It's an interesting thing that some of them will come in and they'll say, well, when I was getting out, the guy said, you got any ringing in your ears? And I said, no, because what I hear is a buzz.
Yeah.
And so, it's that I try and say, when I ask the question, I try and say to them, do you hear any sounds that you shouldn't hear? And that brings it out. Like, oh yeah, I've got this clicking, I've got this buzzing, I've got this whatever.
Yeah, so there's various
Yeah.
different types of sounds. Each individual has
Absolutely.
their own kind of thing.
Yeah.
You have questions? We have answers. The SITREP is your trusted source for veterans benefits information with expert analysis and interviews with leaders from the field. To find past shows, podcasts, and other content, search #TheSITREP on YouTube.